This bill recognizes that our safety, our physical dignity is more important than a private profit, that it is wrong to keep people trapped in an abusive relationship just so a company can make a profit. You have no doubt heard from your own constituents who have remained in violent marriages, often with children in the home, because their choices were to stay or go without health insurance. We have heard of abusive husbands manipulating their spouses with the health insurance, threatening to cut it off for them or their kids. Every place our social safety net fails is a vacuum where violence festers. People don't stay in abusive marriages because of their spectrum packages. They do stay because their abusive husband is the only source of health care for them and their kids. As we vote for this bill, we are making a choice and saying that the phone company's profits are not as important as your safety. The cable company's bottom line is worth less than your life. I think you would have a hard time saying otherwise. And yet, every day we choose to maintain the American health system, we are making the opposite choice. We are saying that your lives are less important than Aetna's quarterly profits. Endure violence in your own home so that United can exceed its growth targets. We cannot throw up our hands and pretend we don't have a choice. There is a better way, the only way, and that is publicly funded health insurance via the New York Health Act. I am voting aye and urge my colleagues to join me in demanding the New York Health Act. I rise in defense of people like my brother, Mel. As a child, I heard him coughing so often that it seemed like just a part of who he was. As an adult, I understand that Mel was struggling to breathe because of his asthma, and that it is no coincidence that it is so often black boys from the city like Mel who end up with asthma. People in transportation hubs across the state experience respiratory issues as a result of the poor air quality caused by planes, cars, and buses. In New York State, 210 out of every 100,000 children experience respiratory issues, and the rates are even higher near transportation hubs. This bill is an important step into looking at the health impacts caused by some of our transportation centers. But what about the people in the Bronx, or my home borough of Brooklyn, who live near tens of intersecting bus routes and experience twice the statewide rates of childhood asthma? As we work to protect the health of future children, we cannot abandon those already living with asthma to a healthcare system designed to profit off of their struggle to breathe. We need to ensure that the people who are already impacted have the care they need to treat their respiratory issues. I vote aye and invite my colleagues to join me in demanding the New York Health Act. It should be the right of all workers to retire with dignity. It should be the right of workers to have health care. Retirement and pension programs provide a necessary safety net for workers and their families. We should continue to expand these programs. However, we must go beyond just expanding these programs in this instance. Healthcare is a human right. That is why our public sector safety net should be expanded to all New Yorkers. I'm voting aye and urge my colleagues to join me in demanding the New York Health Act. As the bill's authors point out, kelp has significant health benefits and is a nutritious food with a growing market. The lack of affordable, nutritious food is a problem for so many communities in New York, and this bill would help us change that. Because kelp contains large amounts of iodine, it is also used to produce supplements for treating hypothyroidism, a condition affecting approximately 1 in every 300 people in the state of New York. Hypothyroidism is a very serious and potentially life-threatening condition, since the thyroid glands produce the hormones regulating metabolism, mental functions, and energy level. Yet, kelp-based iodine supplements are rarely an adequate or even appropriate solution to this condition. While a healthy diet is important, New Yorkers need preventative health care, affordable prescription drugs, and routine, stable access to medical services, all things that they are often denied under the current system. Kelp can help if it's paired with a single-payer healthcare system. I'm voting aye, and I urge my colleagues to demand the New York Health Act. Attempting to reach emergency personnel at the border between Nassau County and Queens County has been a challenge for some callers. Dispatchers often do not recognize the location of the caller as within their jurisdiction and refer them to another jurisdiction. This confusion and uncertainty endangers citizens as they wait to be connected to the correct responder, something that they should not need to do in an emergency situation. I rise because I understand that living in one of the wealthiest societies on earth, those who have never faced an emergency might assume that reliable systems exist to provide urgent assistance if they do have an emergency. People probably hear about situations like this, and their natural response is to think that this is absurd. If someone is calling an emergency services dispatcher, it's because there's an emergency, because their life, safety, or health is at risk if they don't receive services right away. In such a situation, doesn't it seem ridiculous to quibble over something trivial like where the border between Queens and Nassau County is, or to direct a person with an emergency to a different operator, wasting crucial time in what could be a life or death situation? What kind of people are we if you let something like that happen? Isn't it inhumane to be so concerned with details like that when there are lives on the line? But that is the exact situation that we find ourselves in when it comes to healthcare. The same situation we found ourselves in for years. We let the insurance industry bureaucracy get more and more entrenched as people die waiting for authorization of a procedure or rationing their insulin because they can't afford more, or being unable to get to a hospital in time because they live in a low-income area where hospitals are underfunded and can't afford to stay open. We've gotten accustomed to this, but we need to remind ourselves that it's not normal. There's a solution that gives us back some of the humanity that we've lost by failing to care for each other's needs. Under the New York Health Act, we can get the care that we need when we need it. Just like someone who was in an accident on the Jericho Turnpike shouldn't have to wait to be connected to the correct responder when they make an emergency call, no one should have to leave the pharmacy without the medication they need to survive because the insurance industry hasn't approved it, or explain to the hospital how they're going to pay for immunosuppressive drugs before they'll be approved for a life-saving transplant. I'm voting aye and urge my colleagues to join me in demanding the New York Health Act. A recent study by the United States Environmental Protection Agency determined that emission controls have been removed from over 500,000 heavy-duty vehicles in the last decade, resulting in excess emissions of more than 500,000 tons of nitrogen oxides and 5,000 tons of particulate matter. EPA estimates that in New York, more than 13,000 heavy-duty vehicles have disabled or removed emission controls, resulting in excess emissions of over 13,000 tons of nitrogen oxides and over 100 tons of particulate matter. This bill prohibits the tampering with devices for emission control systems on motor vehicles. We know this is necessary because there have been scandals in recent years where certain car manufacturers were involved in a major scandal where they cheated pollution emissions tests in order to boost their profits. Transportation emissions from the combustion of diesel fuels result in particle pollutants that have been linked to lung and heart disease. Low-income communities and communities of color face increased levels of vehicle pollution as these communities are often intersected by heavily trafficked areas, transportation corridors, expressways, and routes populated by heavy-duty vehicles such as ports. Requiring pollution control devices to be intact will help reduce this disproportionate emissions burden, thereby improving health outcomes. This bill recognizes that an ounce of prevention is worth a pound of cure and seeks to avoid adverse health outcomes for New York residents. This also underscores the necessity of preventative care, something that New York residents all too often can't afford or access under our for-profit healthcare system. Just as we need to pass this bill before us today, we also need to pass the New York Health Act. I'm voting aye and urge my colleagues to join me in demanding the New York Health Act. This bill takes important steps toward providing necessary rights and protections for people of all genders. All of us deserve care and respect, but transgender and gender non-conforming people have been denied that care and respect for far too long. Recognition on official documents will go a long way to turning that tide, but as anti-trans legislation sweeps across the country, New York must set an example by radically addressing the unmet needs of our trans constituents. A major barrier to the well-being of transgender and gender non-conforming New Yorkers is a shameful lack of access to comprehensive health care, especially gender-affirming care. Equality and justice across gender cannot be realized until people have access to the care they need regardless of their age, income, employment, and immigration status. As it stands, gender-affirming health care is difficult to access and prohibitively expensive for a huge number of our trans siblings. Even when gender-affirming care is covered, insurance companies and payers place discriminatory requirements and restrictions in the way of necessary care, forcing people to jump through hoops, and even then, often arbitrarily denying payment for services. The problem is so severe that GoFundMe even offers a how-to guide on fundraising strategies for gender-affirming care. We can't leave people's survival, dignity, and well-being up to the whims of a crowdfunding website. The New York Health Act would cover comprehensive health care for all New Yorkers, including providing for gender-affirming care free of cost, and it would mean that the insurance companies no longer get to place arbitrary burdens on doctors and patients to stay in-network or get authorization for the care they know they need. We can and we must remove bureaucratic obstacles to the rights of trans and gender non-conforming New Yorkers, like this bill aims to do. But until our low-income, undocumented, uninsured, and underinsured neighbors are able to access the care they need through the New York Health Act, we're not done yet. I'm voting aye and urge my colleagues to join me in demanding the New York Health Act. Thank you, Mr. President. COVID has been devastating for New Yorkers' livelihoods as much as for their health. Estimated job losses in the state due to the pandemic range from 500,000 to 1 million. New York City lost 13.6% of its payroll jobs, twice the national rate and more than the next 14 largest US cities. Before the pandemic, New York breweries supported more than 20,000 jobs. For each one of those jobs, there are significant costs that are incurred paying for employees' health care. The bill that's under review right now would support breweries in New York by allowing them to open immediately without waiting for certain licenses to be issued. Not waiting on licenses can be a big deal for small businesses. Having healthy employees without having to shoulder the cost of health insurance would go even further. I vote aye and invite my colleagues to join me in demanding the New York Health Act. This bill relates to public health. Combustion of this fuel oil creates soot composed of toxic mixes of pollutants that are easily inhaled and can cause a range of serious diseases that affect infants, children, and the elderly, including asthma, bronchitis, cancer, heart disease, and pneumonia. What else do these illnesses have in common besides arising from the combustion of these fuel oils? At least two things. They were all dangerous comorbidities that lead to higher rates of complication and death from COVID-19, a disease that was more common and more deadly for New York's communities of color, who are more likely to be exposed to environmental pollutants and less likely to have access to consistent primary care. Under our current profit-driven healthcare system, getting treatment for these illnesses is very often prohibitively expensive for the very people most likely to be impacted. An inability to access care early can lead to worse health outcomes. New Yorkers often have to put off treatment of these illnesses because of cost, because they weren't insured, hadn't reached their deductible, or weren't sure where they could receive care without getting a denial from their insurance company. Far too often, these delays mean that the illnesses caused by the combustion of these fuel oil become more serious or even deadly. Hand in hand with our profit-driven healthcare system, burning oil full of pollutants and carcinogens in our homes and offices is making people sicker, putting the most vulnerable among us at the highest risks, and creating long-term problems that will only get worse the longer we don't address them. We need to pass the New York Health Act to stop this vicious cycle. I'm voting aye and urge my colleagues to join me in demanding the New York Health Act. This legislation from my colleagues relates to traffic collisions that involve turtles and the ability of municipalities to post turtle crossing signs on local roads as a preventative measure. When a turtle is involved in a traffic collision on Long Island, they can receive free health care from Sweetbriar Nature Center, a nonprofit wildlife rehabilitation center, and other animal rescues. The 12,000 New York human residents who are involved in traffic accidents each year, however, may not have such luck. Taking care of our turtle families rises to the highest ideals of this legislative body. Turtles cannot vote. They cannot donate to our campaigns. They have no voice in Albany, so we must be their voice. But while we consider how best to care for turtles, our human constituents are also dying. Turtles are known for their slow pace, and the time needed to cross the road can be extraordinary. They need the protection of municipal street signs just as New York residents need the protection of the New York Health Act. Local municipalities know where their turtle populations are and are best suited to identify and locate signs, just as the New York Health Act divides New York State into regional bodies so each can manage their own healthcare needs. But most importantly, all victims of automobile collisions need to be free from healthcare bills whether they cross the road slowly, quickly, or drive cars. S6401 would provide that help to turtles. The New York Health Act would provide that help to all of us human New Yorkers. I'm voting aye and urge my colleagues to join me in demanding the New York Health Act.